And thank you very much to offer the opportunity to talk about that, the AMBAR project, because AMBAR project for me and for my team in ACE Alzheimer Center Barcelona is one of the great projects, because we start with the Grifols company in order to design the AMBAR project in 2004. And really, when we start to work with AMBAR, the idea became from the Grifols knowledge in two great areas. The first one is the blood donors, because as one hemoderivates company, they knows very well the processing in order to build products derived from the blood. And the other is about the effects and the functionality of one of the most important proteins in the blood, that is albumin, that it represents the bigger and the bigger volume of the protein circulating in plasma. And the effects and the first proposal is, we know how to remove blood and to remove plasma, and we know how is the functional effects of albumin. And if we build this one regarding that albumin is the carrier, they transport and carry nearly 90% of the A-beta in the peripheral compartment, that could be a new approach to offer a new treatment for Alzheimer's disease. In the past, the first question was if patients with Alzheimer's disease could tolerate this new approach, the plasma change. And the other, if it's safety, easy, at the end, they offer benefits. When we start in 2004 to design the proof of concept, the third question was completely answered. Is patients with Alzheimer's disease tolerates and understand very well the process of plasma change. Plasma change, the procedure, is one procedure that it's accepted and introduced in the world of the medicine nearly in 1950. We have a lot of experience, and we have a lot of experience as neurologists, but not in the chronic disease that like Alzheimer's disease, in very critical situation, in very critical symptomatology that it's appear in the area of neurology. The myasthenia gravis is one in the critical situation. The multiple sclerosis in a very critical situation. Critical situation is depend of to reach the improvement, because this kind of patient can die. And the other is in the Guillain-Barré, and the other pathologies is Crohn, and the other pathologies is the hypercholesterolemia, familiar hypercholesterolemia, with no response with statins. That is our goal. That is the goal of the plasmapheresis, very well known. And we move this procedure for the critical situation in the critical room in the world of the chronic. The first one, proof of concept, we reach easy for patients with Alzheimer, very well tolerated, and with no side effects, very well manageable side effects. The second clinical trial was the Phase II, and it's not a proof of concept. We are manage patients in US and Spain, and the number of the patients reach 45, and we focus this clinical trial in mild to moderate patients with Alzheimer's disease. And we start, the design of this clinical trial really was one dose founding, because we established 3 different arms of dose, in those of number of the procedures and in those of the use of albumin, and to remove this volume of the and the blood of the peripheral compartment. And we always working with a total plasma change. The patients that we include in this clinical trial was patients about 55, 85 years old, with a phenotype, that it's important, with a clinical diagnosis following the NIMS-ADRA criteria, no with biomarkers, in order to detect biological AD, biological Alzheimer AD. It's only with clinical criteria, and we include patients about 55, from 55 to 85 years, with a clinical diagnosis, diagnosis of the NIMS-ADRA criteria, probably AD, and with a mini-mental scores between 18-26. And we divide this range of MMSE, mini-mental state examination, between 2 stages. Mild AD, when the score of the mini-mental state examination have a range between 20 to 26, and moderate AD, when the mini-mental stage examination, the score range 18-21. And we treat this kind of the patients, and the objective was safety, first one, the tolerability of the procedures, and the clinical results. And this clinical trial offer us the possibility to understand the mechanisms that we introduce in this new approach for patients with Alzheimer's disease. Safety, continuous, have a not so much, less than 5% of the adverse effects, very well tolerated. The other, the tolerability of the procedure was very well tolerated in these 45 patients, and we start to work with the placebo arm and the treated patients. That is an important novelty, and it's an important challenge for the AMBAR project, because plasmapheresis, the plasmapheresis, it's used for a critical patient in a critical situation and in the critical care room. And we modify this concept of this kind of the process for the chronic disease, but we introduce the placebo group. That it's not possible when I treat one critical patient, because my objective is to save and to alive this patient. And when we examine and we analyze the results, we found that the behavior in terms of the clinical benefits with the placebo and with the treated patient was completely different, because the treated patients, it's improved in cognition and if improved in quality of life. And based on the results, the company takes the challenge and the risk to design one clinical trial, Phase II, to be in US, the Phase III in Europe, and the name is AMBAR.